Nice talk on OCT angiography. We'll move on to the IC, that is setting up a VR practice. A lot of us have finished our fellowship or have been working elsewhere, and then we decide to open shop. We decide to start our own practice. And because not all of us are born with a silver spoon, like these gentlemen or this gentleman. So we have to plan our finances much better, and we have to make sure that for every rupee that we spend, we get the maximum possible return. So new step is usually a huge decision, and it has a lot of implications both, and the way you plan your clinic or any equipment for that matter has implications on the way your practice is going to develop and how comfortable you're going to be. The first step in thinking about setting up a new clinic or an institute or any institution or any machine is to decide the scope of your setup and the role of the equipment that you plan to buy. Whether it's going to be a OPD setup, do you think you are going to have a surgical suite? Are you going to set up a primary center or a peripheral referral center that feeds on to your major surgical center? Does your equipment have to be mobile, or is it fixed? It's going to be in one location? Do you want to start the setup full on with all the equipment from the day one, or have you planned to incrementally increase the number of devices that you have, instruments that you have? And of course, you have to pay attention to the clientage that you have or what you have in mind. And then comes the budget that is available. So first impressions have a very lasting impact on the patient psyche and on the conversion of patients for procedures. So you have to set aside a certain amount for interiors. If your place is rented, I would not go over the top, but if it is your own place, then you can spend a little more on interiors because it's going to be lasting and it's going to be there for a long time. Always seek professional help when designing because they can use spaces more, they can make the place much more functional than we can. And plan beforehand for future purposes. Always reserve some space for future expansion because all clinics, all hospitals grow. CCTVs are a must because in today's medical legally very volatile climate that we live in, it is always better to have a good CCTV and preferably in key places with audio recording, and that is what we have. Choose your instruments wisely. The instruments have to be chosen according to the site. If it is a premium setup, you cannot go with basic instruments. The example that I've given is that if you cannot have a Trinetra or a Remedio type of a fundus camera when you are projecting yourself as a referral institute. If it is a peripheral referral center, a fundus on phone type of a device may suffice, whereas if you are treating primarily at one particular center, then you may have to have a better equipment. Academic versus commercial. If you are interested in academics to a significant extent, then you need to have good quality instruments, otherwise you will end up frustrated. If the volume is low, then you should try to limit your expenditure. If the volume is high, then usually you can go for costlier equipment. What you have to define early on in your practice, what is essential and what is luxury. To give you an example, a single spot laser is an essential thing, a multi-spot laser is a luxury. Same way, a time domain OCT is no longer a luxury now, it is an essential thing, but a SERP source is a definite luxury. In the operating room is where the maximum stress is. You have the maximum stressful time in your day in your OR, so let it be a more comfortable zone, spend more on the OR. So once the first step is that you generate a generic equipment list. I want a laser, I want a microscope, I want a non-contact system. The first thing is generate a generic equipment list. In front of that, mention the options under each heading. So what are the options that you have? How do you choose those options? Generally, it's best to keep 3 or 4 options, not more than that. The strength versus weakness of every particular option has to be listed. The first and foremost thing is it going to have an impact on therapy? If it improves your quality, that particular option gets a higher rank. Does it improve your comfort and the patient comfort? Another important factor in our times is that does that particular equipment reduce your reliance on assistants? So if you have a non-contact system, you probably don't need a very reliable assistant to hold on to the contact lens on the cornea. So choose wisely. The maintenance issues and recurring costs come next because they are also important considerations, and then come the cost differences. So it's not always just the cost of the machine which decides whether you're going to buy one particular option over the other. Always, if you've worked on that particular system, fine. Otherwise, always take demos because you don't know where and what problem it's going to create in your particular setup and in your hands. Now, a case in point is you always may not have this kind of a setup where you have a Lumira microscope and a DORC EVA machine, the highest end system, but things can be managed at a much cheaper scale also. This is a disposable biome which comes at less than 1/10 of the cost of a biome, and it gives you the same quality. Same way, a footplate of a biome, which if you buy the original one, on the left hand side, it costs you nearly 1.25 lakhs. Get it made in India. We've got very good manufacturers that make the exact same thing at less than 1/5 of the cost. So always list out your options and then choose. Once you're well versed with the available options, then you rank them by preference. Again, its role and its impact on results is very important. If it is a primary machine, that is the one that you're going to use all the time, let it be a better machine. Otherwise, you can have a second-hand equipment or a lesser machine with lesser capabilities as your backup. If you're going to use the machine very frequently, then it should be of a higher order, because that is going to improve your comfort and performance. The cost of use and maintenance also needs to be calculated depending upon the volume that you are expecting. And there are certain instruments that have a very high return on investment. The ones that you use very frequently have good ROI. However, there are certain instruments that have a low ROI. For example, in today's time, a fundus camera has a very low return on investment because you use it in lesser and lesser number of cases. But it is an essential thing that you need to have in your practice. So here, you can choose an option which has slightly lesser features and is cheaper rather than going for a highest end, because you're going to use it much less times. Always never ask for the quotation from the company before negotiation. Always negotiate first, then ask for a quotation, and then again start your negotiation round, because then you have a lot of leeway. You can bring down the prices further. A very good option is to consider second-hand equipment. Now, second-hand equipment does not always equate to bad equipment. How do you decide whether you're going to go for new equipment or second-hand equipment? If your role of equipment is to be the primary equipment, or it is a diagnostic equipment on the basis of which you're going to take treatment decisions, you probably are better off going for newer equipment. Anything that is computer-based, has a lot of computing power required, or software upgrades, it is always better to go for new equipment. Things that have more lenses, more mechanical parts, you can very well go for second-hand equipment, because these do not degrade with time. Where the technology has changed, for example, between Stratus and Cirrus, time domain to spectral domain, you should always go for a higher end technology, because otherwise you'll be forced to change very soon, and that is going to be an additional expenditure. So the way we take decisions when we are planning to go for a second hand equipment is that first take the technical decision, the technology decision, then comes the volume decision, how frequently you're going to use it and in how many patients. Are you going to use that machine for marketing? For example, our anterior segment colleagues use the femto cataract for a marketing purpose. So obviously, things that you are going to use for marketing as your USP cannot be second-hand. You have to have them new. And then comes the risk decision. By risk decision, I mean, whenever you are considering buying a second-hand equipment, do consider the cost of the parts of the machine that need to be replaced. If the cost is very high, for example, in lasers, if the laser cavity cost is very high, and if you have to replace it, you're probably going to be, it's going to come as good as buying a new machine, then better buy a new machine rather than going for an old system. So look at the individual cost of the individual components that need to be replaced. So what do you look for? Whenever you buy a second-hand thing, there are certain commandments that you need to follow, otherwise you'll end up in soup. Always deal with reliable players, especially get references from people who have bought the machines earlier. Always hire a technician, not the vendor, a technician whom you rely, independent guy whom you trust to inspect the system. Research the equipment service history. All equipment has serial numbers. So you take the serial number, get the service history of that particular second-hand equipment from the company, and you will know exactly what has happened and when it has happened to the equipment. Buy the latest model you can afford. Even among second-hand equipment, there are different models available. So among them, always buy the latest model you can afford, but also spend time to look on the individual components. If you have a 15-year-old laser, but the laser cavity has been replaced recently, then it's almost as good as a new laser. So spend time on the components. If you're going for refurbished, factory refurbished, for example, Zeiss sells factory refurbished OCTs, always ask the details of the refurbishing process. Get a list of all that has been. If they have refurbished a particular part but not a critical part, then you are in for trouble. For example, if the spectrometer of a OCT has not been replaced and you're buying an old OCT, then you're in for trouble because that costs almost 6 to 7 lakhs. If they've just replaced a galvanometer which cost maybe 50 to 75,000, then it's not much of a refurbishing that has happened, okay? So get the list of all the components that have been replaced and when. So you will be, you'll know exactly how the machine is going to perform. Get the facts on warranty and serviceability. By this I mean that whatever vendor you are going to buy the second-hand machine off, ask them whether they're going to take that machine into warranty. I may, for example, buy a Nidec OCT from somebody else, but I will call up the Nidec guys to ask them whether this machine can be now put under warranty with them. So then it can be taken care of. Also, in second-hand equipment, always ensure from the company that the spare parts would be available for the next at least 5 years. If it is not so, then you are in for trouble. Let's suppose you have bought new things. Is that the best thing? You still have to be careful. Be very specific about the model and features in your purchase order. Write down everything that has been negotiated very well in the purchase order, every single thing. Otherwise, the company has a tendency to go back on them, and keep a copy. A lot of us give the purchase order to the company, we don't have a copy of it, and then the company says you didn't write that. Check the invoice that is received. How do you check the invoice? You physically inspect the equipment, you counter check your serial numbers with the invoice, you inspect the equipment for physical damage and the functioning. It takes about 5 to 10 minutes or maybe 15 minutes, but it is worth doing all this. Always ask the service engineer to show you the service and the shipping record of the new equipment also, because everything nowadays is done with management systems that have everything detailed. Every single moment of the machine is detailed. Always ask the service engineer to give you the admin password of your devices. For example, if you want to get your device checked by a third party and he does not have the admin password, he cannot make any sense. He cannot go into the machine software to find out any details about the machine. So get the admin passwords also. And check all the conditions in the CMC and AMC. Small example I would give here is that a lot of companies void the CMC of a particular electronic device if the earthing or the electrical connection is not up to standard. Now, whenever you are getting an engineer to install the machine, ask him to check it and certify whether the point on which he has put the machine is all right or not. If it is not all right, get it corrected before you install the machine and start using it. Otherwise, 3 months later, just 3 months after a new machine is bought, they may ask you to change a very important or a very costly component and you would not be left with any choice. So all the time be alert. This is the second last slide. Negotiation is a very important tactic in reducing the prices and getting the best. Always, one thing that you have to remember is medical equipment has very high profit margins. So what you can do is that confirm from, there are certain websites where you can get the landing price in India of every single equipment. So look at that and then start the negotiation process. Talk to reliable colleagues on what they have bought the machines at. Pitch competitors head to head. Try inviting both the vendors on the same day at the same time and meet them. They will lower the prices much more than they would when they meet you individually. Try fixing the rate in INR. The international market is fluctuates quite a bit, and sometimes lakhs of rupees can be lost in the conversion rate. Bargain hard and be patient. Never show the company that you are impatient and you want the equipment very fast, because that just totally closes your door for negotiation. And always push for additional CMC. It is the machine, if you're buying a new equipment, it is the company's responsibility for it to function for a reasonable length of time, and they do give additional CMC if you are a little pushy. Be shameless in negotiation. They are. Okay, so I'll conclude with the slides. The do's and don'ts when buying equipment is make a research list, drive a hard bargain, always read the fine print of all the conditions, consider buying second-hand or pre-owned equipment, be alert during the installation process. Do not compromise on the results of your treatment just because you bought a cheaper machine. Do not be rigid. Look at different alternatives. You have much cheaper and different alternatives available. Do not overreach. Don't try to buy everything at the single go. You can plan it in advance. Don't deal with shady vendors, and don't just chase the price. You may have to buy a costly equipment if it really impacts your treatments and makes your life comfortable. Thank you.